Sorry, everybody.
All right. So we had a few fights here and there because I didn't understand her. She has lost her sister, and then your old man comes to hospital, and with all the comorbidities around him, it felt like that was the end of the tunnel. But I have seen several older people and all that coming and making it through. So we did a chest CT, we were monitoring him, and he was fine. So I go in to see the old man, I encourage him. But when you come out, families are not allowed to see their relatives and they don't know what is going on. And it was a little scary to the families, but not to me. And then by God's grace, gradually, the old man was getting well and was asking him, when am I going home? When you see people asking, when are you discharging me? It's a good news because they are getting better. At a point when you pair them with others, and then so what I do is give my number to all the patients in there. At any point in time, if you need help is not coming, just ring out to me. And the old man called that there's another patient who needed help close to him. Then I knew that he was really, really doing well. So fast forward, we had a few grudge here and there. And at a point we have to settle at the middle. And Enam did mention that, oh, she has lost the sister to COVID and she had the comorbidities. And I find it so difficult to understand, some of those things, because then again, everybody is sort of finding it difficult to understand if they are on my line, because most of the medicine we use to treat COVID, dexamethasone, metaprednisolone, tocilizumab, and some others are immunosuppressant, hydroxychloroquine, which was helping at a point. They are all immunosuppressant. So I think that if you have a condition that actually suppresses your immune system, then you should rather fight the COVID better, not, make you fall prey. So she agreed to set up, this app to help people. And to be honest with you, she chased me for a long time because, I'm always running around, following up on my patient, calling them here and there. So I wasn't really listening to anything. But gradually, we're able to come to a compromise. And by God's grace, she donated the items she mentioned to us at Deborah Ward. And I was so happy for myself and so happy for my patient, because sometimes you see patient come in and you want to monitor them from home. At the point ward was full, people needed to be at home and be monitored. And they can't afford to buy a glucose, strips and a machine. They don't have a BP machine to even check their BPs at home. And even the basic labs you write for them, they can't afford. So the items came as a savior. And even on our ward at a point, we needed more because the patients were many. Every day you are adding numbers. Sometimes you just have to let people sit and check through your patient who is quite a little stable, discharge them, and then throw more in there. So the telemedicine was actually a savior. All right, so items were brought in then. So can you move forward for me, please?
Okay.
All right, so to summarize all the long talk, we should understand that the COVID-19 pandemic has brought a lot of revolution to our world, a lot more virtual meetings, and then through the platform we are using today. Why do we have to do this? Because we needed to sort of create that social distancing and reduce the cost of patient transport from home to hospital, optimize the time management, And also the optimum aim was to prevent the spread of COVID-19. Then again, you see a lot more people coming to the OPD on daily basis, and they are in trotro. They bought trotro from their home, come to the hospital, and they will take same trotro back home. And you can imagine a number of people who are likely to get COVID from these people. There was nothing we could do. So the items came in to help. I gave the items to poor people who really need to be monitored or to be followed. Those who can procure or those who can buy were encouraged to do so, but those who could not were given a pulse oximeter and then the glucometers and the strips. But the 2 BP machines were kept at our center there. I mean, when you come, we just measure your BP. If it's up, it's up. And I believe it wouldn't take like 2 weeks or that few days for your BPs to rise from, say, 120 to 170. Though a lot of things can happen for those things to happen, but we felt we could keep the BP machines at our end and then use it when they come. So, I mean, telemedicine, people have done it over and over again. Even before the advent of COVID, friends will call you, Charlie, my head is paining me, running stomach, headaches and all that. You write prescription, snap it and send to them via WhatsApp. And so we've been practicing it, but it officially came to the light when COVID came in. And at a point, it was the main modality of treating patients, and it has really come to help. All right, so telemedicine, that was about it. So, I mean, few benefits. And so using the healthcare software, I mean, for follow-ups, means that, I mean, your patients are likely to be seen at the appointed time or the scheduled date for a review, because if they are home, they are in their car, if they are in trotro, they are in the office, they remember that they have to communicate with their doctor, they are likely to do so. And so you less likely to miss appointment. And those with chronic illnesses who are one way or the other stressed out. I mean, chronic kidney disease, renal heart failure and all that. They are tired going to hospital all the time. But if they can sit in the comfort of their room and then communicate with their doctor, send their lab results and have discussions virtual, I think it really helps. And so their sort of their condition or their deterioration or whatever it is can be properly monitored and then adjustment made as and when. So less time away from work. I mean, you just take 5 minutes in your corner and then you communicate with your doctor. People have to travel distances. I mean, if you're coming from Kaswa to 37 just to check your SpO2, I mean, it doesn't really make a lot of sense. It makes sense though, but I mean, costs and the spread of COVID wouldn't have been curtailed at a point. So a lot of privacy you can have. I mean, so exposure to potentially dangerous patient, especially the COVID. You know, at the point people come for review at our end. When they come, they sit together. Sorry, please, am I speaking too fast? Okay, I think I'm rather
No,
singing.
you're fine. The pacing is just perfect. Yes.
Okay,
we are just very attentive students listening.
Thank you. I thought I was singing.
No, you're not singing. And I'll come in if there's any problem. Trust me on that one.
Okay. So if I'm rapping, you just tell me, then I'll slow down.
Okay.
So they come to the clinic and people have recovered. They are coming to see you for a review. People have tested positive. They are coming to see you for reassurance and medications and all that. And they sit together. And you can imagine, one is coughing, breathing and all that, touching nose here and there, moving from one chair to the other. They sit on this one, hold it. And I mean, unfortunately, if you happen to sit on that same chair, hold the handle of the chair and then scratch your nose or something, and there is COVID particle that you are likely to get. And so telemedicine came to help in that regard. So I think a lot of schools are using it a lot. So you can just check your their vitals and then upload it on a page, and people can, doctors, healthcare professionals can look at it, assess, and then give you. So, I mean, also relieve a lot of stress, pressure on the healthcare workers. And because you just have to send me a text that, oh, I've checked my BP, I've uploaded. Even if I'm in a meeting, I can look at it, and if there's any need for intervention, I do so. So the next slide, please. All right, so there was a good news for myself and my patient, and that was Ghana Health Monitor. So as I mentioned earlier on, I was approached and I was interested in making sure the old man was fine and then going home. And somebody too was interested in, like, let's get an app for everybody. And we have to go forth and back, and a point we settled on agreeing to let this thing come to light. And by God's grace, it came to light. So to say a few about my patient, there was a patient I discharged. She was going home with a sugar of 23 millimole per liter, and that is still quite high. And to be honest, I did that because I've been studying the COVID, the diabetes, the sugar control in a lot of the patients for a long time. I mean, I realized there was a man I discharged with 23. He went home on the medications. He was checking his sugar every now and so, in the morning, in the afternoon, and then in the evening, and sending me the figures. And I realized gradually, week, day after day, and then week after week, sugar was just coming down gradually, and then it settled. So this woman I'm talking about was from Takoradi. The son is a nurse, was being managed at a hospital in the Western region. She was deteriorating. They called, they wanted to bring her to 37. And in fact, it was so sad to know that this woman would have to call his son at home and tell him that my oxygen is finished. And the son will have to run to the hospital and inform the nurses that her oxygen is finished before, I mean, a new one will be fixed. She will scream and there will be no help. So they arranged to bring her to 37. She came, and at a point, she was in low levels of oxygen for a long time, a week, and I was even scared for her, but I mean, she sailed through. So I gave her the machine, the glucometer strips and the glucometer itself. She checked her sugar and it was like so high. At a point, she had 25 to 26. And checked the ketones, and the ketones were 0. And at a point, she had +1. But then again, I wasn't scared because I've seen over and over again, and people get better. So we just have to, fortunately for me, the son is a nurse, so we could just adjust her insulin. And then over time, sugar just dropped and settled at the baseline. And it was just because we had the strips for free. And honestly, I give to them for free. Unfortunately, I mean, the ordinary Ghanaian, once you tell them somebody donated this for this work and we don't charge you, take it for free, and we take their telephone numbers as well. There's one man I've called to return the pulse oximeter. He's not even answering my call. But to be honest, it has really helped, and it has saved, if not more, even just one. Because there was a patient who got the pulse oximeter. We checked his SpO2 and it was 96 and above. And so I told him, you keep checking irrespective of time. If you go below 90, call me. And at the point when he checked, it was like 84. And so if he can't afford the pulse oximeter and he didn't get one to check, and the SpO2 kept dropping like that, and it was in the night. I mean, the next thing is that, I mean, he passed on in the night, and he had the comorbidities, which we didn't want to hear. So to summarize on that point, it's been really helpful. And if you look at it critically, I mean, it's been a savior. To summarize, it's been a savior to few people, if not many. Looking forward to get more donations, so a lot more people can have access to the items, and then we can follow them. Until COVID is gone, we will not be I mean, we will not be at peace, and we will not be resting. Not just the COVID, but other patients as well. So I think I've spoken about quite a number of the items on the outcome. Yes, so the next point is for us to sort of extend the services to other units. So even if I'm at a funeral, and a friend in my village, or my mom's friend, or whoever, wherever you are, and I go on my app and check, and I notice that somebody's sugar is going up, or somebody's BP is at a dangerous level, or somebody's SpO2 has dropped to a level, I can sort of call the person and then give the necessary assistance. Let me add this one. There was a patient I admitted to my ward, a young man, though had severe COVID. By God's grace, he was able to make it. And interestingly, he went home and then put a pulse oximeter on his son's finger, and then it was reading 88. So he sensed danger and called me in the night, but I felt it was something more to do with the heart than, I mean, COVID or any other thing. And strangely and unfortunately for them, I made him bring the son the next day. I examined the son, requested for some labs, and unfortunately, the son had one of the rare heart conditions, one ventricle, one atrium. So it's just like we all have 4 chambers, left and right atrium, atria, and then left and right ventricle. The child is just having one atrium and then one ventricle. So his blood is just mixing up like that, and not, I mean, being circulating well. So that's just on the other side. So to summarize, it's been very helpful, and it's saving lives, and it's helping. So we must all come on board, contribute our quota, and see the success of Ghana Health Monitor. Thank you.
Thank you so much, Dr. Opoku-Mireku. So if you joined in late, Dr. Opoku-Mireku is a COVID specialist. He explains that he's not like the COVID specialist, like somebody who knows all about COVID, but it's only because he's done a lot of readings and he's had to deal with a lot of COVID issues. And so hence we call him the COVID specialist. And he works with the 37 Military Hospital here in Accra, Ghana. And if you missed any part of the presentation, it was just basically to take us through the Ghana Health Monitor. So far, what it has done for others, especially his patients who have been beneficiaries of the contribution made by the Ghana Health Monitor. And there have been several consumables that has been given to 37, that has been donated to 37 devices, equipment that are to help you check your sugar, check your blood pressure. All that has been delivered to 37 Military Hospital. And he was just sharing the experiences and how his patients have well benefited from it. And I dare say that it has actually saved lives already. And we hope the whole idea of this is that we can save more lives. So thank you so much, Dr. Opoku-Mireku. And Dr. Opoku-Mireku, I thought I saw something around, in your picture, I see something of a color here. You want to share your rank with us? I am assuming that you are not only a doctor, but a military officer as well. So And you did rightfully say when you were talking about the madam thing. So if you can share with us your rank in the military, that would be also very nice to hear.
Okay, so my rank is I'm with the Navy, so it's called a
Okay.
naval lieutenant.
Okay.
Naval
Okay.
lieutenant, equivalent of a captain in the army.
Oh, I've always wanted to be called Captain Edwina. Oppon. Oh, wonderful. Thank you so much, Dr. Opoku. So you keep staying on, and when Dr. Jasmine Arthur-Quarm is done with her presentation also, all of us on here will have the opportunity of asking questions. And since we have the experts on here, we can also be assured of some answers. So Dr. Jasmine Arthur-Quarm,
hi.
This is your time.
Good afternoon, everybody. Thanks so much, Dr. Opoku-Mireku, for your brilliant insight into how you've managed COVID in Ghana and how the app has really helped with your care for the patients and the wider community. So my name is Jasmine Arthur-Quarm. I am currently a trainee in obstetrics and gynecology in the NHS in the UK. But I mean, as part of my training, you do go through foundation years. And my second year in foundation was when COVID really hit. And so I do have some clinical experience with COVID as well as with obstetrics and gynecology. The main aim of my talk today is just to give an insight into digital healthcare technology and what my experience has been in the UK. And also to show or to illustrate that all this technology that we're experiencing here can easily be translated into Ghana's healthcare system. Although many people might say that the healthcare system is not as robust as what we have here in England, there are some things that we can learn from here that can be applied to help our communities in Ghana. Next slide, please. So digital healthcare technology can be broken down into different elements. We have electronic health records, which are widely used across the NHS and in many different countries. We use our technology for communication, mainly emails. I think the NHS is just now moving away from using fax machines, but emails is where it's at. Telemedicine, as Dr. Opoku-Mireku has illustrated very well, has taken the forefront during COVID to protect both the healthcare workers and patients from mingling with each other and encouraging social distancing, but it's also used in other areas, not just in healthcare, so with education and things like that. In analytics, digital healthcare technology allows us to see how best our services are being used, the equipments that we purchase for the systems and for the different departments, are we using them to the best of our technology, and where can we find improvements? We can use this technology to collect data, which can better inform how we're providing these services to our population, and also looking at securing this information, because there is a lot of confidential things that are included in patients' data. So by using this technology better, we can ensure that things are more secure and we're not just relying on paper folders for things like that. And finally, digital healthcare technology allows us to provide a virtual point of care. So when it comes to the Ghana Health Monitor app, I think it can be classified within the virtual point of care because you have that interface between the patient and the clinician. And as Dr. Opoku-Mireku said as well, it allows you to perform telemedicine, where you can speak to your patients over the phone, or the patients themselves can communicate with the healthcare workers if they have any concerns. Next slide, please. So the benefits of digital healthcare, particularly when looking at something like the Ghana Health Monitor app, for the patient, it gives ownership of their own health back to them. A lot of people tend to, well, from my understanding of what the attitudes towards health is in Ghana, many people just do what the doctor has told them, or they've said that this is your issue, this is what you need to do. By providing this app and providing them with these devices, it's an opportunity to educate them, and then allows them with this newfound knowledge to take ownership of their own health and do look after themselves a bit better. It also encourages collaboration between patients and healthcare professionals. So not just doing as you're told, but actually forming a relationship with your doctors or your nurses to make sure that you are working towards better health for yourself. As illustrated in the previous talk, the patients spend less time traveling to and from the healthcare center, just 5 minutes out of your day to take your blood pressure or your blood sugar levels or your oxygen levels, and then inputting them into the app is more than enough for your clinician to review you and give you some advice on how to look after yourself while you're outside of the hospital. And also the reduced cost of consultation. Many people, from what I've seen, you have to pay to be seen by a doctor. So there is that cost, but then there's also the cost of traveling, the loss of income if you're going away from work. So all of this goes to benefit the patient. Alongside that, for the healthcare provider, you're reducing face-to-face contact. So if you do have patients who are positive with this contagious disease, by reducing your contact, you're reducing the risk for yourself as a healthcare professional, and also reducing the risk for the other patients that you would be seeing in the hospital. You'll also save time reviewing your patients, because using this sort of app, no appointment is required. You can spend just 15-20 minutes of your day reviewing a whole load of patients, and the only ones who would need your input are the ones that you would contact and spend any more time on. And as I mentioned, for both, there's the reduced cost of consultation for the hospitals, the healthcare providers, and the patients. So my particular experience with digital technology, I have experience with electronic healthcare monitoring with telemedicine, but specific to how the GHM app works, my most recent experience has been with health monitoring for women who are pregnant and have hypertension. So hypertension is one of the known conditions that can develop in pregnancy for many women, particularly our women from Black and Afro-Caribbean heritage. And we also recognize that it puts them at higher risk of poor outcomes for both the mother and for the baby if the hypertension isn't well managed. So this can be the severe hypertension itself leading to stroke or heart failure, loss of sight, but most importantly to preeclampsia and eclampsia. So that is why it's so important that we're monitoring our patients with this risk of hypertension. So prior to the instigation of an app similar to GHM, our patients would be seen by the community midwife or in the antenatal clinic, who would then identify that this patient has a raised blood pressure. That there would be that way of notification, or someone who already has existing hypertension and then gets pregnant. They would then be advised to attend the hospital for regular BP monitoring, and then some of them would have to wait for a doctor to review them before they go home. And this can be a once a week visit to the hospital, or in severe cases, they would need to be seen every day for their blood pressure monitoring. And prior to this, if patients wanted to monitor their blood pressure at home, they would have to purchase their own equipment to do this. Next slide. So with the digital health monitoring app that was introduced in the previous trust I worked in, we would identify these women again in the same ways that we would prior, with the raised blood pressure and who are at risk of poor outcomes. And then these ladies would be registered for the health monitoring service. This would be done by a specialist midwife who would then educate them on how to use the blood pressure machines and how to use the application, and also when they should be concerned about their blood pressure readings and seek medical attention at that point. These patients were then shown how they could input these readings online, which are then checked by the midwife or doctor who is allocated to review these patients. So when this data is reviewed, if there's any concerns, then advice will be given over the phone. And then if the readings are of significant concern, then our patients would be told to come into hospital for further review, further blood tests, and just to repeat, to ensure that they are using the machinery correctly. So this is what would be provided to our patients throughout their antenatal period and even for the postpartum period. So once their care is complete, their baby is born and the BP is controlled, these patients are discharged from our care back to the general practitioners, and the devices are returned to the hospital team and then used for any future patients. So the benefits of using this in antenatal care were that the patients were very happy because it meant that they did not have to come to hospital daily. The population we were dealing with were usually younger mums who had other children that they had to look after, who needed to be taken to school and picked up from school, and they had their families to care for. So this took less time out of their day so they could attend to their other responsibilities. That also meant that our patients understood better when they needed to seek medical attention, what symptoms to look out for that were of concern, and also what blood pressure levels were of concern. For the clinicians, it only took about 15 to 30 minutes out of the whole day to review the patients registered to the service. At one point, we had about 60 patients who were actively being managed using this app. And this was all the time that it took to look at everybody. And then if there was anyone who needed further intervention or further input, that time could be taken. It meant that the healthcare practitioners were free to look after other patients who were in hospital needing inpatient care. But aside from that, not only did it allow us to make sure that the patients were being well looked after, but also identified patients who were non-compliant with the management of their high blood pressure, and meant that we could target more support to them. And this is something that can be easily translated to our patients in Ghana. So yes, as I've just said, the principles of digital health monitoring can easily be translated to Ghana. Although, yes, statistically, Ghanaians have a poorer population than in the UK, majority of the population uses mobile devices. And this app is affordable. It doesn't take up much space on the phone and is accessible to almost every device through the App Store and through the Google Play Store. So that means that most patients that Dr. Opoku-Mireku and his team and my other colleagues in Ghana would come across would be able to use an app like this for their own management. The devices can be loaned and tracked to patients. Because we are registering their details, you can register the devices to them, and then hopefully chasing them up to make sure that the devices are returned. That way we can keep using the same devices and it would reduce the cost to us in providing the equipment for the patient's care. COVID itself is an acute condition, and the use of health monitoring can be beneficial over a short period of time, particularly during the isolation period. So it allows for social distancing, and as it's a short duration, it is more cost effective for us to be loaning these devices rather than just giving them to patients. As I said, better self-isolation to protect the healthcare workers and social distancing for the wider community. It allows us to identify early who needs intervention, who needs to come into hospital, and to escalate if we see that a patient's deteriorating whilst at home. And hopefully by doing this for our patients, it will lead to better outcomes for them. Okay, thank you.
Thank you very much, Dr. Jasmine Arthur-Quarm.
I hope I didn't speak too quickly.
No, it was fantastic. The pacing, all of you had good pacing. So it helped to get the information across. And you know what I was just thinking when I listened towards the end of your presentation, then I just realized that Ghana Health Monitor has just introduced a health device library, because now you can just go pick a device, take it home, use it for your benefit. And when you're all done, you're all safe, then you just bring it back to the hospital. This is awesome. And so at this point, everybody on here, this is your good chance to ask all the questions that could be boggling your mind concerning the Ghana Health Monitor app and the whole service. If you have any questions, this is the opportunity for you to come in and ask the question, and you certainly get your answers. So I am ready for questions. If you do not want to speak, you can just use the chat system, send a message there, and I'll read out your message to our speakers here. So I'm giving it about a minute. If we have no questions, then it means that our presentation is spot on. Everybody has gotten the message. And then any further information, then we'll give it. And then if our speakers have any additional tips to add, they will add it. And then we shall bring the launch, this beautiful launch, to a successful end. So any questions? And I'm checking the chats as well to see if anybody is sending anything in there. Yeah. Okay, so I haven't received anything yet. So
please don't be shy. If there's anything you want us to clarify, just write it in the chat, or and then we'll answer the questions now. This is a great opportunity for us to hear from people who aren't immediately involved. You could point out something to us that we hadn't even thought of for this app. So we'd really appreciate your input.
Exactly. So you can also DM, you can send, even though it's a chat, you can send it specifically to either the doctor, myself, or Enam, or Dr. Mireku. You can just send it specifically to them as well, and then they can just attend to the question, So I have some 30 seconds left. If there's no question, then we can move it on. Okay, so I have a question, and it says that, what measures are being taken to help educate the masses in Ghana about this app and the benefits of check-in? So I guess I would, Enam, let me put this question to you. What are the measures being taken to educate the masses about this app? Because it's not going to be such an easy one, though.
And thank you very much, Sal, for this question. I think it's a sea change in the way health is delivered. And so it would have to really depend on the traditional media as well as, social media to really send a message out, and using opportunities to discuss this, perhaps health clinics. And I think that in the nascent stage, it won't be a mass rally. I don't anticipate that might work, but it would be really targeted at patients. So, for instance, what Dr. Opoku is doing in Affect 7, even educating the doctors themselves about what benefits there are. So perhaps collaborating with Ghana Medical Association and some other health policy institutes in Ghana, and then really sharing about the benefits of it. And so I anticipate that it will take perhaps another year or two until we are really fully embedded in the system of sharing that information and sharing how it can really be helpful to people. Now, of course, sharing the stories of how it is worked, because at the end of the day, everybody is interested in impact. Yes, you've done this, so what? And I always ask that question, so what? So it's about giving people and this. So this is the number of people that we potentially supported to achieve better health, and really emphasizing that message. So yes, Stella, I totally understand that we have to educate the masses, but it would be educating, as Jesus said, educate people in Jerusalem and then go to Judea and then go to Samaria. And we can't take Samaria before into the uttermost parts of the world. We have to start from Jerusalem first. So that's from hospitals. Thank you.
Okay, and Stella, I think what I will also want to add to it is that for a patient, the fastest way to reach a patient is through their doctors and nurses, their health service providers. And as you heard Dr. Mireku share quite a number of experiences, the more you have the patients coming in with the issues and the more he's introducing it to them, the more we are spreading the word. And one of the powerful tools of spreading information in our country is word of mouth. So that is also another way that this is going to help educate the masses, not to debunk the fact that on television, radio, print, and all, we need to go out there and share this information to the others. So point well taken. So somebody said, God bless you all.
1 minute.
Sorry, Enam.
Stella's hand is up.
Okay, so there's some messages here too. Oh, but Stella, okay, if you want to practice something or add more to something you said, go ahead, please.
Okay, this is a different Stella.
Okay,
Yeah,
so we have two Stellas.
Yeah, just to congratulate you all for the hard work you've done so far, and for making today a reality. Having listened to all of you, Dr. Mireku, we have to really applaud you for all you've done to keep our country going and keeping us COVID safe. I think my question now is around how the health professionals are going to plug into this Ghana Health Monitor. How do you envisage this happening? I don't know if it's Enam or...
Okay, so Enam can take this, but I will want to take it from Dr. Opoku-Mireku's point of view, being a doctor in Ghana. Usually you would know what the practice is and how easily your co-doctors, your colleagues will easily sort of tie into this. So Dr. Opoku-Mireku, if you can help convince us a bit.
Okay, I will convince you. So I have actually contracted a rotation nurse. The truth of the matter is that patient healthcare ratio is woefully bad. And so if you want the nurse to check vitals and enter those details into the system, it's never going to happen. So I've spoken to a nurse yet to start, to come to the emergency on daily basis and then record all the readings of the patient that will come to the medical emergency into the system. So when the doctors log onto this app, then they can actually see their patients, their vitals, their BP, their sugars and all that. Then, I mean, over and over again, it become interesting. Oh, I just log on and I saw my patient vitals. Very easy. So they can, even at home, they can still monitor their patient. So that is the angle I am looking at. Then again, it's either the medical student or the nursing student. And even the primary school, JHS and SHS, they should rather be the target now. So because in few years to come, I mean, the SHS is going to a nursing school or a medical school. And once he's rooted or he's used to this app, then he's more likely to sort of continue to use it and then educate others as well. So I think that is a two, I mean, strategies I have thought of adopting. I mean, Madam can add hers. I mean, she doesn't want to be called Madam, but sorry about that.
And any other you want to add?
So what I've thought about really is speaking to Ghana Medical Association. And of course, going with evidence. And that's why for me, the proof of concept is so important. Because once you're able to demonstrate in a proof of concept that you've got a solid plan, or not even a solid plan, a system that works, you know, that delivers the goods, that's able to save on time, on money and on cost, then people are likely to listen. So once we're able to gather the evidence from the proof of concept, go to Ghana Health Service, go to GMA, and then explore funding sources. I mean, that is one of the ways. Explore funding sources to really scale this. So it is really about talking to the medical professionals and having, fora like this, open fora where we share the evidence that we have gathered, and then help them. And then once they're able to, satisfy themselves with the questions that they have and the evidence that we have, then, slowly, over a period of time, maybe another, year to 2 years, we can begin to embed this, because a lot of it is behavioral change, a lot of it is attitude change. Like Dr. Mireku, rightly said, go to the schools with the universities with it and say, this is what we're doing. This small service is achieving this footprint. Is it possible to explore this further and train nursing students, medical doctors, and what have you, to understand how it works, and then speak to the public providers, and as well as the public, the private providers, on how it can ease their work. It can ease their work.
Okay.
So as we go on, you would we're trying to raise funds now as well for tablets. So the idea, like what Dr. Opoku-Mireku was saying, that so for certain communities, and somebody has asked a question about vulnerable communities or hard to reach communities, if you have clinics where people will just enter that information directly for them, then it will be useful. Now, the thing with the vulnerable in the hard to reach communities, would have to use the service of the CHIPS compounds. So if you're not familiar with CHIPS compounds, so a CHIP compound is like a mini hospital, where you would go with your primary care needs. And the research that I discovered is that about 2% of our population have diabetes, and a lot of them don't know that they have diabetes. I have reached out to a few media people who are diabetic, to see if they can take the message forward as well. So go to those vulnerable communities, maybe target one where there's a high incidence of a certain disease, and that's where data analytics is so important, critical. Because then where the need is the greatest. And once you know where the need is greatest, then you can target that. Otherwise, you'll be shooting blind, and you will not really achieve the efficiency. So going to perhaps those communities, finding out what the data says about a place like Choko. It might not even be a place like Choko, it could be in Lima, and see how you can have these interventions, partnering with the CHIPS compounds, so that you have somebody there, maybe a national service person, a trainee nurse, who would then physically do the inputting, and then we can do the data collection. But as much as possible, it's quite a lot of work. But I think we're looking forward to recruiting more people who are volunteers to come and support us, both in Ghana and here in England, so that we can actually really do this.
Okay, so MFR, I think Enam has just also answered your question concerning communities like Choko in Ghana having access to these innovations. So I think pretty much she has tackled that. Dr. Arthur, were you about to say something?
Yeah, I think I wanted to also highlight that the concept for this was developed for an outpatient setting initially, but Dr. Opoku-Mireku has demonstrated that it can actually be of huge benefit to the inpatient care. And I do have some experience here where I've seen systems that are managing inpatient observations and vital signs, and they're of great use. But like Dr. Enam has said, we will rely on people volunteering their time, and being able to reach these communities. It might be good to be able to recruit from these communities, medical students, any charitable organizations that are involved in outreach will probably be our best port of call, to get more stakeholders who would be able to get more patients involved in this. But yeah, I think inpatients use would be the best way to get our healthcare providers educated about how this app can work. But then from the community perspective, that's when our private healthcare workers or community clinics would be of best use to target these communities.
Okay, so what I think I can add to this, being a Ghanaian and being in the country, I can appreciate more of the questions concerning how does it reach the masses. And because this is a free service, I believe that it's easy for us to collaborate with the media so that they can come on board. And once we have a certain commercial or so, we can give it to all the media houses, both television and also radio. So that is something that will also, I think it will be something that will be taking steps towards. And anybody here who is interested in, maybe you might have an access to any of our media platforms, you can also volunteer. So if the money is, or the contribution is not coming, service contribution can also be equally accepted. So I think that's another way that we can quickly help to spread this word. So I think I'm not getting any questions. I think we have done some good justice to the questions that are lingering on in our minds. And it was the basic thing when you talk about an app, and it concerns Ghana, and especially when you want to help more of the masses, these are the key questions that anybody will ask you. And I know that with time, and with time doesn't mean in the next 20 years, but as we move on from here, we'll all take steps to make sure that we sell the information to all the media houses. It's a free service, so it's not like it's anything that Enam or anybody makes a profit of. So we'll find a way to get everybody on board, the media, and so that we can spread the word further. And then we also have the hospitals and the doctors to also share the word. But however, we still need to hit our target. I can't hit on that enough. Our target, if you missed it, our target started with £5,000. We have been able to make £1,000, and £1,000 is already saving lives. We've donated a lot of consumables. We've donated some equipment, the devices for checking our sugar, our blood pressure, and oxygen in the blood. Is that it? The doctors? If I'm saying it right, that's right. Yeah. So it is time for us to contribute one way or the other. No, this is not like offering time. No, that's not what I'm saying. But this is also to say that, and I should think that we have an account number or some form of medium that if anybody wants to contribute, exactly. So here we have it. So if you want to contribute towards this beautiful, wonderful, life-saving moment. And the interesting part is that it's not even just connected to COVID. This is for our general well-being in the country. Just before I came into this meeting, a colleague of mine in the office went for checkup. And she said while she was there, an old woman came and they checked her pressure. She was somewhere, was skyrocketing around 160 over something. And her blood sugar was in the tens. And the nurse was screaming, my goodness, your sugar is too high, your pressure is too high. And she didn't even understand what the woman was talking about. So you can imagine, even when she leaves the hospital today, she's just going to take some few measures and call it a day. But if she has a doctor, somebody who is seen to her and say, take this, go and check it. When you see number this, it means you are in trouble. If you see this number, you are okay. If you see this number, call me. It's all going to help our people, you know. So I think this is a great initiative that we should all find our way to contribute. And like they say in the Akan balance, kitwe biensa. And it's always said that little drops of water makes a mighty ocean. So this is not about we needing somebody to come and pay a 1,000 boom or a 4,000. That wouldn't be bad though. But we're just saying that every little that you can get, just throw it in, and then we can make a difference in our country, Ghana. So with that said, I will go to our speakers. If they have any further comments to make, they can make it, and then we bring this wonderful launch to a successful end. So I take it from the first speaker, Mrs. Eyiah, anything to add?
So I just like to highlight that in terms of our next steps, a lot of people are probably asking that. So it really is to have the evidence, scientific evidence-based proof of concept, thinking about scale. So like Jasmine rightly said, look at inpatient care, outpatient diabetes and hypertension management, women's health care, gestational diabetes and hypertension, recruit clinicians, and then obviously funding for equipment and capacity, because with capacity we'd have to secure the data. The other thing really is to try and integrate with some of the technology applications that are happening in Ghana now. So one key one is the digital address system. So integrate with a digital address system so that people will be able to pin their location to where they are, and then integrate with the ambulance service so that if they need care and it's urgent care, it's easier to find them, because then the ambulance service would easily locate the person because they're using the Ghana digital post address. So that's the next stage that we're working on. And also, since I've been hacked before, and I'm still reeling from having lost 14 years of my life, my digital life, I am really conscious of securing the data that we have on here. So working with the app developer so that we take our cybersecurity really, really seriously, especially because you have people's personal data on there. And that means also registering with the Ghana Data Commissioner. I've begun moves on all of that so that we can have secure data and also protect ourselves against hacks. And so you know in terms of your money where it's going, consumables such as lancets, you use it and once you throw it away. So the one-time use, and this is how much it costs, £10 to get a box of 250 strips for diabetes is 17 Ghana cedis. Now remember, I took my dad to 37 for his post-COVID checkup, and we were charged, was it 7 Ghana cedis or 10 Ghana cedis per strip?
My clinic is 5 cedis per strip.
So I think Dr. Opoku was there, and I wasn't really having a go as a nurse. I was only asking questions.
Today, my colleague paid 10 cedis for a strip. So
I was really asking questions. I was asking, why my dad, who was a former army officer, should be paid for diabetes strips. And the young lady made a point to clarify how expensive it is. I was just pulling your legs, but the fact of the matter is that they are expensive. 50 of them, can worth the maths. And you need this test strips every day. So if you're going to test yourself twice a day, you would go through one box of £17 in less than a month. So I can imagine that the test strips that I've bought, for this project are finished. So we need to replenish them. And of course, a good quality oximeter costs about £30. The ones that cost about £70, which would be the gold standard. But we're very aware that we can't do gold standard just yet. And of course, the blood pressure monitors and the tablets, so that we can have health professionals actually go within inpatient care and try and support our doctors So deliver more efficient care and ease the pressure. You know, when you go to hospital in Ghana, everybody is under pressure. And they're under pressure because of the time constraints and because there aren't labor-saving devices. I mean, ask yourself, when you were growing up and you had to grind pepper on a stone, you know, when somebody is asking you a question, you're just throwing them off because you're thinking about the labor-intensive work that you're going to do. But if you think about the fact that you're just going to have to blitz something for a few seconds and you've got your stew ready, you know, life is a breeze. So it's the same way we need to think about the challenges that our health professionals are going through. I mean, when my dad was in hospital, you go to 37, and I mean, how it works, you have to go and see your patient very early in the morning, and just in case they need blood or whatever, so that you can take that to the lab, take them food. It is laborious work. And yet we have health professionals that are there 24/7. So somebody like Dr. Mireku, you know, when I go there in the morning, 6 o'clock, 7 o'clock, he's there. If you go there at 10 o'clock, 11 o'clock, he's there. He's constantly there. He's like a woodwork on the wall. And it's a story for many of them. So yes, you know, their attitude sometimes is not great, but it's because of the pressures that they face. And that's why he's my best friend now. So once we make things easier for them, remember that it means that when we ourselves are in need of care, or when our relatives are in need of care, that they're able to deliver more better care. So that's it for me.
Fantastic. Thank you so much, Madam Enam Akoetey-Eyiah. Borrowing the word that you most dislike from. So Dr. Mireku, you be the next person. Any final words you want to give to our participants on here?
Okay, so 3 quick points. I would want to use this platform to let everybody knows that the symptoms of malaria and COVID are just the same. And unfortunately, people go to clinics and hospitals, they are treated for malaria for 1 week. They are treated for typhoid for another more week. Then again, typhoid, malaria symptoms also the same. And strangely, I mean, they would test for typhoid and it will always be positive. So malaria 1 week, you didn't get relief. I mean, typhoid another week. So by the time they come and you think it is COVID, it's almost like late. So I think we should encourage our friends, family, and everyone. If you are sick, it's not about pharmacy, paracetamol, and then aspirin. It's seeing a doctor. And if you go 3 days, you are not feeling well, just come to a bigger center and you get help. Number 2, it was so unfortunate. I remember that incident of the major being asked to pay a 10 cedis Ghana for the glucose strips for his sugar to be checked. But that was because I felt we shouldn't let anybody come pass through without sugar being checked. And we didn't have access. So I personally bought some of the strips. And so, I mean, to be honest, for the soldiers, it was free. But if you're not a soldier, I mean, then you pay something little. So at a point, it was a miscommunication from the nurse and all that. But I mean, a soldier's wife, a soldier's child, they are not supposed to pay. So that was unfortunate. I'll refund that one. Oh, it was.
Okay. Thank you so much, Dr.
Yes.
Mireku.
And then
there's a third point, isn't it?
Yes, yes. And finally, I think that we are always around. If there are any challenges, you can reach out to us. If your family members are not well, whatever, time is not a limiting factor. You can call anytime. When there is life involved, I mean, we must run around.
Okay.
Thank you.
Thank you so much, Dr. Opoku, Dr. Bernard Opoku-Mireku of 37 Military Hospital, the man who has been seen to a lot of our COVID patients and seeing to it that they come back home and with us. So finally, we have Dr. Jasmine Arthur-Quarm to give her final words, and then we wrap it up.
So I think both Auntie Enam Akoetey-Eyiah and Dr. Opoku-Mireku have made excellent points. I think we should really drum down to our family and friends in Ghana about the similarities between malaria and COVID, because we can't escape malaria, but we also need to be aware of the risks of COVID. So if there's nothing else you take from this talk, make sure you take that away and share it with everyone that you know. As a young doctor starting in my field, in obstetrics and gynecology in particular, I am acutely aware of how important it is for the health of the population to be good enough for the development of the country. And I think this app, although yes, it is starting off looking after patients with COVID at risk of developing other conditions, it's just the springboard to allow us to expand this beyond just COVID and looking after the general health of the population. And so all of you who are here, thank you so much for giving your time to attend this talk. I hope that by listening to this talk, you've learned something more about what this app is about. And if you want to find out even more or want to be involved, don't hesitate to contact any of us so we can point you in the right direction. And it's only through collaboration and sharing our knowledge and time that we can do things that are going to benefit our families and our communities. So thank you.
Thank you very much, Dr. Jasmine Arthur-Quarm. And thank you everybody for coming on board for this evolution of the Ghana Health Monitor app. And on this note, I take the powers to declare that the Ghana Health Monitor app is duly launched. And if we could open the microphones, we could hear our own claps. And then this is a big thing, and I believe that it's going to go a long way to be a blessing to all of us. So you can always, if you're using Android, just go on Play Store and you can check out the name Ghana Health Monitor and check out the design. You find it and then you download it. If you're using an Apple phone, on iPhone, you just go to the App Store, you will find it there, Ghana Health Monitor, check out the design and click on it, download, and you're in business. This, I believe, is going to be a great innovation that is going to go a long way to bless and to change the lives of our Ghanaian communities. And so thank you. I want to, on behalf of Enam, Mrs. Akoetey-Eyiah, say thank you to each and every one of you for making it here. We know the time is in the afternoon, so some of you are at work, all manner of activities are going on, but you made the time to come and be part of this, and we are truly grateful. We want to also say a very big thank you for our speakers, Dr. Bernard Opoku-Mireku. I'm wondering what has been happening at your unit right now for the past 1.5 to about 2 hours now, maybe 1.5. Judging by how busy you are, always attending to our COVID patients and other patients as well. Thank you so much for taking the time to even put in all the knowledge and wisdom to see to it that we can understand how this Ghana Health Monitor does benefit the people. And then to Dr. Jasmine Arthur-Quarm for sharing the UK experience and also giving us hope, because once we know that in a certain world, which is not too far, it's not in Mars, we are all on Earth, and somebody can, the digital health system is actually working somewhere, then it gives you the strength or the encouragement that it can work in Ghana as well, because all the technologies, we are sharing it in Ghana, in Africa for that matter. So if we are all using WhatsApp, we are all using Zoom, it means that Ghana Health Monitor can be used everywhere as well. So thank you for also sharing that experience with us. And thank you to each and every one of you. I wish I could go through all your names and thank all of you, but we appreciate you so, so much. Without you, we couldn't have done this. And we believe that when you leave here, 2 things. You're going to spread the word about Ghana Health Monitor, and in your own little way, one way or the other, you're going to contribute to making Ghana Health Monitor something formidable that is here to stay, and that is not going to be a 9-day wonder. Remember, the consumables are expensive in Ghana. If you can even buy a pack of strips a month or every 2 months or so, you're saving a life. You're really saving their lives. Trust me, our mothers and our fathers, they don't know much about these things, and it's killing them when they shouldn't be dying. These are things that shouldn't kill them, but for lack of knowledge, the people are truly perishing. So thank you, and God bless you all for being here. And we continue to encourage you that the target is £5,000 for now. We will increase the target in the future, but for now it's 5,000. We have made 1,000, and we are still hoping that we can hit that target very soon. So if you have missed my name in any of this, voila, my name is simply Edwina Oppon without the G. So if there's nothing from any other person, I say that thank you and have a blessed day.
1 minute, Adriana, before you close,
Sure.
everybody, there's somebody who's got their hands up.
Okay, let's see.
Number 217.
Okay, so I see, they say thanks very much for the good show. This is coming from Stella. Thank you, Stella. Thank you so much, Stella. And yeah, who has raised their hand again? I think we are good then.
No, they're 217. I can see them.
Okay, then go ahead, please.
Hello, please, can you ask your question?
Yes.
Hello? Okay.
Yeah, because the hands I'm seeing, okay, I see 217 and let's see. Okay. So is 217 coming with a question?
I suppose perhaps not.
Okay. So thank you, everybody. And it's a wrap, like we call it in film.
It's a wrap. It's a wrap. It's a wrap.
Bye.
Thank you.
Thank you very much.
Thank you. You're welcome.
Thank you so much. This was a lovely talk.
Remember, yes, remember, go and spread the word. Ghana Health Monitor, spread the word.
Don't worry, I'll be #1 promoter.
All right. Okay.
Okay.
Thank you, everybody.
Thank you.
Thank
y'all.
you. Bye.
Bye.
Bye. Okie dokie. We have 11 more people to go. 10 to go.
Yes, yeah, mom. It's from me. No, it's not mine.
Bye, Stella.
Hi.
All
Okay,
those who,
I'm going back to work.
yes, all those who stole your way to come out of work
Bye.
to come and do this. God bless you. Thank you. Stella,